Good morning and welcome to the show. I've got a very interesting person in the studio this morning in the way of Bonita King-Steinkamp. And Bonita is a hypnotherapist and a comedy hypnotist.
Yes, that's right.
Welcome.
Good morning, Don.
Welcome to the show.
Thank you so much. I'm so happy to be here.
I don't think I've ever met a hypnotist before.
Oh, well, that's very interesting. I thought they were quite common nowadays.
No, you would be my first, and really,
Great.
you never forget your first. But, but hypnosis, a lot of people like tongue-in-cheek. It might be just more of a, for comedy, and maybe more of an act than real therapy. I mean, does it help people?
Yes, it does. Hypnosis is very helpful in helping people to make good choices for things that they might want to accomplish in their life. Of course, all hypnosis is self-hypnosis, so when we have something that we want to make a choice on, we actually go into downtime on our own, give it a lot of thought, and come to decisions on our own. And if there's something that we can't quite come to a decision on, sometimes hypnosis can help us focus and concentrate even more, seeing a therapist, so that we can make the decisions and make choices.
So it sounds a lot like meditation.
It is a lot like
self-hypnosis.
meditation. It's a lot like meditation, and with a guide. That's the difference. So a hypnotherapist can guide a person in the direction that they want to go very easily, where meditation you may go down into an altered state and achieve results or just dream. So it all depends on what's happening at the moment.
But I would imagine that type of therapy would be good for maybe someone who has a bad habit, like smoking or drinking or things like that, behavioral type things.
Behavior modification, yes, and it's used quite readily for behavior modification. Behaviors are also choices that we make on a subconscious level. The only reason we use hypnosis is to help a person open up that subconscious mind where the changes are made, because everything rests in our timeline. Everything we've ever done in our life rests in our subconscious mind. That's where behaviors are anchored. So to change a behavior, to go in, we just go in there, and they're more easily changed when the conscious mind is at rest.
Now, you also have another side to you, and that's the entertainer side. You put on a hypnosis comedy show. And I don't want to talk more about that because you have one coming up soon. We've got to run off to a break in the local weather. But after that, I do want to talk about the whole comedy thing that you do with hypnosis, because we all know it can be very entertaining.
Yes.
And stay tuned, because after this break, after your local weather, I will be clucking like a chicken. No, only kidding. To your local weather now, brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm here with Bonita King-Steinkamp of Capstone Learning Center. She is a hypnotist. And now, I'm not going to ask you to hypnotize me here, because some of that may spill over into TV land, and we don't want anybody getting hurt out there. But you do put on shows, and you got one coming up on this Saturday, don't you?
Yes, I do. The 27th at 7 o'clock in the evening. We'll be meeting at the Capstone House, and we'll have a big show that night. Our shows are really big. We fill the house.
Where's the Capstone House at?
Capstone House is 1713 Beck Avenue in Panama City.
And you have a comedy show with hypnosis.
Yes.
Now, who goes to these things? Is it young people? Is it old people? Is it a good mix of people? Or?
We have people in their 80s, and we have people as young as 12, 13, 14. When we have volunteers, they have to be 16 and over to volunteer in the lineup. And there are people who are extroverted and want to put on a show, or people who just want to experience hypnosis for the first time, possibly. So they'll get up and they'll line up, and they're the entertainers and everyone else just sits and they watch and they have a good time. And there's a lot of laughter. And we have a lot of family units coming in, and we encourage them to come. 10 years old is fine. Bring your kids and really enjoy the show.
I don't want you to give up too much, but what would I expect to see when I go to one of these shows?
Well, what you see is I give scenarios and the people act out the scenarios. And here's the exciting and fun thing. They have punchlines you wouldn't believe. They'll give you a punchline in a second, and you wouldn't believe this comedy is coming from the ordinary walk of life.
So you're a comedy hypnotist.
Yes, but I'm not the funny one. The volunteers are the funny people. They're just outrageous. They're fun.
That sounds like a really interesting time,
It
to
is.
say the least.
It is.
Now, how does someone get to become a hypnotist?
Well, I used to be a heavy smoker, and when I was 45, the doctors told me I had 5 years to live if I didn't stop smoking. So, and I thought, well, I've been trying for 2 years. So I went to a hypnotherapist, a student. And that student hypnotized me, and I became a smoker in 1 hour, a non-smoker, actually.
But there's some people that just can't be hypnotized. I mean, is my brain too thick?
Well, the beauty of it is hypnosis. All hypnosis is self-hypnosis. So what we do is it's what we tell ourselves. It's the power of suggestion. And so when we're in a downtime, when we really believe what we tell ourselves, that's what we achieve. So we want to make sure that we're telling ourselves exactly what's going to really work for us in our lives.
Benita, you are probably one of the most fascinating people we've ever had on this show.
Well, thank you.
And thank you so much for coming on.
You're very welcome.
And good luck with your show this Saturday, too.
Thank you. We're going to have a great time. Everyone come out.
Okay.
Join us.
And we'll be right back after your Mad Hatter Minute.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Today we're going to be talking about brakes. It's a great thing when your car runs right, but it means very little if you cannot stop. If you're maintaining your vehicle on a regular basis, you're rotating your tires every 6,000 miles. A good service technician, when rotating the tires, will be inspecting the brake system. They'll be looking at your brake pads, your brake calipers, your brake hoses, and your brake rotors. It's up to that technician to come back out and tell you, the customer, that you're getting close to needing a brake jobs. Brake jobs are a very simple process. A sign you can tell by yourself if you're going to need a brake job is a vibration. You get a vibration in the steering wheel, or you get a vibration back in the seat when you're applying your brake pedal. What this is your brake pads are closing in on your brake rotors, and your brake rotors are getting warped. They're warping left, they're warping right, getting high and low spots. And when you press your brakes, it creates a vibration which you feel back into your steering wheel and back in your seat. You'll know you need a brake job when you hear a high-pitched squealing noise coming when you're braking. Now, that squealing noise will come when you're pressing your brakes, and sometimes you'll hear that squealing noise when you're just driving down the road. What that is on the brake pad, there's a little tab, and it's a hardened metal, and it makes contact to the rotor. When it makes contact to the rotor, it emits a high-pitched squeal. That's your car telling you you need a brake job. And when you hear that noise, get your car to a shop as soon as possible, because a simple brake job is going to turn into an expensive brake job before you know it. I'm David Lovett, and this has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247, and we'll check it for free.
Welcome back to the show. I'm here with Dr. Tara Griffin at Emerald Coast Dental Sleep Medicine. And you know, last episode we had talked about educating docs or other doctors on these appliances, because their first recommendation may be something other than a dental appliance, wouldn't it?
Yes, it is. It's often CPAP as the first line of treatment for what most physicians will recommend for their patients, whether they're mild, moderate, or severe. And however, as we mentioned before, the American Academy of Sleep Medicine has changed their guidelines over the last several years, and a lot of the doctors don't realize that. So what we're trying to do is educate and let them know, to be able to share with their patients that have these problems, there's an alternative option. And actually, the first line of treatment for mild to moderate cases are typically the oral appliances.
So the guidelines have now changed.
They have changed.
And not everybody's totally aware of that.
Yes.
And I guess it's part of your mission here at Emerald Coast
Yes.
Dental Sleep Medicine to educate the docs and say, not necessarily CPAP is the way to go, is it?
Yeah, I mean, when it's needed, you know, it's severe cases
Yeah.
and major health problems, yes, there's certain situations where you would not take someone off of a CPAP machine.
Sure.
But at the same time, there are more cases that actually could use an appliance that are mild to moderate and tolerate it a lot easier.
So doctors and patients have options other than a
Yeah.
CPAP.
Yeah. And combination therapy if needed. Maybe there's a severe patient
Yeah.
on a CPAP, and we use this corrective type of appliance to develop them and help to reduce their sleep apnea. And over time, they may not need either one. You know,
Can you explain to me how that appliance works? Because it really looks like something for your teeth, but it really is for your palate, isn't it?
Yeah, it is. It actually does a lot of different things. It's very comprehensive. It helps to open your airway naturally, non-surgically, remodel it, make it larger, as well as align the teeth better, align the jaw better, and it helps to improve your facial cosmetics, your symmetry. So it can broaden your smile. It does a lot of different things.
Isn't that something? It's pretty amazing stuff.
It is.
And but doctors aren't totally aware of this. And is
No.
this new? I mean, is it?
Well, it's new in the last 10 years. It's new in the last 3 years. I introduced it here locally 3 years ago. And I'm actually a certified instructor for this company. So I have the ability worldwide to go train other doctors how to do this and offer this to their patients. There are only a few instructors. And so I'm very fortunate to be able to offer doctors to come in here locally to our clinic and learn how to do this, as well as treat our patients with it. And we've had great success.
So the response has been positive then.
Yeah, very, very much so.
Yeah, I mean, it's always good to have another option. It's always good to have a less invasive option than, say, surgery and that CPAP. Good grief, who can sleep with one of those things? I see that thing. It looks like something out of a 1930s horror film.
They're trying to improve it. They're different types, and some are smaller than others, but for the most part, it's still a struggle for a lot of people.
Now, is this the answer for everybody? Because I see you have some other appliances here. And that thing actually corrects your palate and opens the airway and all. Now, what would something like this do?
Yes, it's not a one-size-fits-all. Basically, we do a consult to see if you're a candidate and what type you might be a candidate for. This is corrective. This actually, much like a CPAP, just helps manage the problem on a nightly basis. And so it splints the airway forward by holding the jaw forward. It's very comfortable. They're all custom made. They're all adjustable as well with little screws on the side. So therefore, it makes them extremely effective. It's not the same thing as walking into a drugstore and buying something over the counter or ordering it on TV for $9.99. What you have to watch out for is you actually you can make permanent changes over time with your jaw. You can create problems. You know, your teeth can shift and move with these other temporary types of things. And so it's important to go with someone that has advanced training in this and can monitor these types of things to make sure you don't have problems later. And two, to test the effectiveness of it, because when a patient goes into treatment with an appliance like this, within a few months, we actually have them do a follow-up sleep test with the appliance in their mouth to test the effectiveness of it to make sure it's taking care of their apnea, if it's managing it well enough. Because if not, we're going to need to change it, adjust it, introduce something else. We have to monitor this very closely.
So other than the obvious physical examination, to get a baseline, you're going to have to get a sleep study, is that right?
Yes, that's to get started to know if you have a problem, and the diagnosis is a sleep study. And it doesn't have to be in a lab. It might be one you can take home. So
Are there x-rays and other things like that involved, or is it just...
It's mainly just to diagnose the sleep apnea as a sleep study.
Yeah, because we're dealing really with the soft tissues for the most part.
Yeah.
And then, of course, the palate, I guess there's some bone structures and all that need to be pushed and rearranged.
Yeah, when it comes to
that.
dental appliances,
Yeah.
we do x-rays. But until then, you just need a sleep study.
It's pretty amazing stuff. But thank you so much for getting us smart on this stuff, and we'll be right back. Welcome back to the show. I'm here with Dr. Stephen Favaloro from Forest Park Animal Hospital. We're going to give you your pet health tip of the week. Welcome back to the show, Doc.
Good to see you, sir.
Yeah, hey, you know, we were talking earlier about things you can catch from your pet.
Absolutely.
And there's a technical name for that?
It's called zoonosis.
Zoonosis. That's an easy one to remember.
Or it's a zoonotic disease. Basically, it's a disease that crosses species. You can go from cat to dog, cat to person. You know, not too many things will go from person to dog or person to cat. But
so
usually
can your
we'll
dog catch your cold if you have a cold or a flu?
You know, they say it's not supposed to, but way too many times I've seen family member get sick, animal get sick, and vice versa. But you know, one of the more common things we see with zoonotic diseases is ringworm. You know, a lot of people think ringworm's actually a worm. but it's actually a fungus.
Yeah, yeah.
And in people, it looks like a circular red lesion, but in pets, it just looks like hair loss. And the two most common species that spread it are actually cats and horses.
Horses?
But,
that's surprising.
but cats can spread it to dogs. They can spread it to people. And some people can be resistant to it, but most of the time, if you have a cat that has it, and you got more than one person in the household, you'll see it. And the one bad thing about ringworm too is that the spores can live on the hair, and they can live up to a year in your environment. So you could have like a cat that's shedding or whatnot before you treat it, and you could have a hair in the corner of the room that never gets vacuumed up, that everybody gets treated, and then 5 months later everybody's got it again.
And you can still get infected from that hair.
Yeah.
Wow.
So hookworms and roundworms
just
are
another
real
reason
common.
not to like cats in
Stop
my
it.
book. I know you're an animal lover, but I'm kind of a dog guy.
Yeah.
Really. And,
but hookworms, roundworms,
Yeah.
those are intestinal parasites that we commonly see in dogs and cats, and they can be transmitted to people. I mean, you have to come in contact with them and, their stool, but it's easier than you think when, the dog went outside and it's shedding parasites and it rains before you get to pick it up, because everybody picks it up.
Oh, of course they do.
And then you walk out there without your shoes on, and attaches to your skin, and the hookworms can cause like these migrating tracks through your feet that are real itchy. But roundworms could actually be much more dangerous in kids. And dogs will go outside, use the bathroom, they'll step in something, they'll be chewing on their toy, they'll be cleaning themselves, you get something on the toy.
Does it actually have to be ingested
it has
for
to
you to
be
get
ingested.
it? Okay. And can it be the actual worm or the eggs?
Well, it has to be the egg, and the egg's going to be transmitted through feces, so you can imagine what happens next. But anyway, that can migrate to the brain or the lungs or even the eyes in kids, and that can cause some serious problems. So, we always want to keep real sanitary and pick up our dog's waste.
Yeah, especially with little kids, because they're hand to mouth, eye all the time.
Absolutely.
Little kids just don't know.
One for just like wow factor, the plague, has actually kind of showed itself up in a couple of regions. Like Colorado, a veterinarian just got treated for the plague. He was treating a cat that was sick, and the flea is actually one of the flea species is one of the ones that transmit it, and they like rodents, which is how it's usually transmitted. And so cats hunt rodents. So this cat got a rodent that had the plague, and then the cat gave it to the veterinarian. It's treated with antibiotics and whatnot, but he had to be hospitalized and whatnot.
That's amazing that the bubonic plague is still out there today.
Absolutely.
In some animals running around out there.
Bacteria. And then so there's one called leptospirosis, which can cause liver and kidney disease, and usually it's transmitted through urine of like a rat, rodent, whatnot. So if you're like swimming in a lake or a pond, or you have a lot of like rodents in your backyard, mud puddles, things like that, you can get it that way. Most of the time it has to be transmitted through broken skin or mucous membranes. So if you just do normal sanitary things, keep your hands clean, maybe wear gloves, keep your hands out of your mouth, that kind of thing.
Oh, jeez.
Rabies is always a big one. Rabies transmitted.
Yeah, I guess you can catch rabies.
And that can be transmitted from any species, any warm-blooded species. So, and rabies is usually transmitted through saliva, and I mean it could be even like saliva from a dog bowl that you go to clean or something like that.
Oh, really?
And
do you have to have like an open wound or something to catch it? Does it
usually
have to
it has
go
to
through
be
the skin?
no. It usually has to be through broken skin or mucous membrane.
You hear a lot about wild animals too, like maybe a raccoon or a possum who's acting strangely out during the day,
absolutely
chasing people.
And there's reports of rabies in Bay County, every year. So we see that, and it could be like there was a case in 1995 where some kittens had gotten rabies, and one of the kittens was adopted, and before they were able to diagnose that kitten with rabies, it had come across 100 people, at a daycare. So usually if you get rabies, it's fatal.
If it goes untreated.
Even if it goes treated. Because once you start to show signs of it, usually you're dead within about 10 days, 7 days.
So I guess the tip of the week is get your pets vaccinated, know where they are, keep them healthy, and just good hygiene.
Good hygiene, absolutely.
That's the key. Dr. Stephen Favaloro from Forest Park Animal Hospital, thanks for scaring us.
Thank you very much. My pleasure.
We'll be right back. Welcome back to the show. I'm here with Josh Singleton, who is part of True Soul and also son of Peggy Sue. Josh, what are you going to do here? Are you going to do LOVE?
Going to be doing a little Nat King Cole, LOVE.
Hey, man, let's take it away.
All right.
I'll try to contain myself.
L is for the way you look at me. O is for the only one I see. V is very, very extraordinary. E is even more than anyone that you adore. And love is all that I can give to you. Love is more than just a game for two. Two in love can make it. Take my heart and please don't break it. Love was made for me and you. L is for the way you look at me.
Everybody.
O is for the only one I see. B is very, very extraordinary. E is even more than anyone that you adore. And love is all that I can give to you. Love is more than just a game for two. Two in love can make it. Take my heart and please don't break it. Love was made for me and you.
Not me and you, but
Yes, please. Clarify.
that's awesome stuff, guys. Thanks so much for coming
Thank
on
you
the
for
show
having
today,
me.
man. And you guys are super talented. And if you haven't seen True Soul, go catch their act at the Buccaneer. Thanks, buddy.